You may be doing all the right things to protect your heart from disease, like exercising regularly to keep it strong, maintaining your weight at the recommended normal level. You may be on a heart-healthy diet that is low in cholesterol, and you may be managing daily stress, which affects the heart. Yet despite a heart-friendly lifestyle, once you hit middle age, not all heart diseases are avoidable.
Many people think if they live a healthy lifestyle that they won't develop any heart disease. But there are conditions such as heart valve disease and disease of the heart muscle that can occur in spite of every effort you make to prevent that from happening.
According to the American Heart Association, about 5 million Americans are diagnosed with heart valve disease each year, and the risk for developing it increases with aging. 4 heart valves lie at the exit of each of the 4 heart chambers. They assure that blood flows freely in a forward direction to the body and doesn't leak backward. If one or more valves becomes narrow, blood flow is restricted. Or if a valve doesn't close tightly, some blood will leak backwards. In these common cases, less blood flows to the rest of the body. Serious symptoms may develop.
You can have serious heart valve disease without any symptoms whatever. However, it's common to have symptoms which start progressive in nature. Start with shortness of breath, then becomes such that you can't sleep at night, you have to sit up and breathe, you get cough, you may also get dizzy spells, you may faint, and you may get palpitations, and occasionally even chest pain. These eventually progress to congestive heart failure, and serious side effects can develop.
An echocardiogram is the painless diagnostic test that can quickly identify and measure valve function. As with other health tests, this one should be done early because valve disease is treatable in the early stages, but becomes life-threatening as it progresses. A center with expertise in heart valve disease and repair can best screen for, diagnose, and treat this disorder. Those at risk for developing valve disease should speak with their healthcare providers about an echocardiogram.
So who's at risk for developing heart valve disease? First of all, there are patients who have a history of heart valve disease in terms of the fact that somebody at some point told them they had a heart murmur or something wrong with the heart. Then there are those who have a strong family history of heart valve disease, as well as those who were told during childhood that they may have some abnormality of the heart valves. In addition, there are patients who have problems in terms of drugs they may have taken that can affect the heart valve disease. Advancing age is another factor, and there are certain medications, as well as infection, which can also damage the heart valves.
A few centers specialize in heart valve disease. One is the Hoag Heart and Vascular Institute, a hospital-based center in Newport Beach, California. Here, heart valve specialists emphasize early detection for people at risk for valve disease before valve replacement surgery becomes the last resort.
The serious valve disease puts a load on the heart muscle, so that if it is not diagnosed in time or is misdiagnosed and categorized as mild when it's severe, then the heart muscle gets progressively weaker. This progressive nature results in heart muscle damage. This damage can become irreversible over time.
I had a physical exam by my physician. At that time, we found that I had a heart murmur, and she had referred me to a specialist. At that time, they did an echocardiogram, which was rather painless. What they had discovered was that I had a leaky valve, a mitral valve. 3 months after that first discovery, they determined that I needed surgery at that point. I went into Hoag Hospital for that surgery. It was a robotic, minimal invasive type surgery, which came out very successful. And I had no pain whatsoever. Recovery time was minimal. I was up and walking in a couple days. It was perfect.
The at-risk population of middle-aged adults and older should know where their valves stand to keep their hearts healthy and disease-free. Tens of thousands of men and women of all ages live with or are at risk for developing a heart valve disease. If left untreated, an abnormal one can cause heart failure, Hoag Heart and Vascular Institute is the first hospital-based center on the West Coast dedicated to diagnosis and treatment of heart valve diseases. Hoag's surgery program is nationally recognized for its expertise in complex heart valve surgery and repair. Our physicians perform more heart valve surgeries and procedures with better outcomes, placing them in the top 10% nationally. If you are middle-aged or older and at risk for heart valve disease, Hoag has the top specialists for you. Expert evaluation and diagnosis start here at Hoag Heart and Vascular Institute.
Reaching the patients who are at risk for heart valve disease, as well as those who have a history of heart valve disease, is really the goal of the Heart Valve Center here at Hoag Hospital. And our mission is to provide accurate diagnosis and treatment and formulate a treatment plan for those patients. And one of the tools that we have used, which has been very successful, are these screenings for those at risk. In addition, we are trying to return the patients back to a heart-healthy lifestyle. And certainly the surgical and medical expertise that we have here at Hoag Hospital provides a unique opportunity for many people with a history of heart valve disease.
For more information, call 866-704-VALVE or visit hoag.org.